This is Channel 3 Eyewitness News this morning.
Okay, well, today is the unofficial start to summer, and plenty of people will be hitting the beach today. But check out these marks. These are skin cancer moles. And coming up, we are going to speak with a doctor about how to spot the signs of skin cancer. It's an interview you cannot afford to miss. We'll be right back.
If you're going to be heading to the beach and outside, don't forget the sunscreen and the shades. Reapply the sunscreen. I think our next segment will have a little bit more on that subject. Right, Heather? You're absolutely right, Curtis. Plenty of people will be hitting the beaches this weekend. But, of course, the sun can also be dangerous. Too much sun. Dr. Timothy K. Chartier from Dermatology Surgical Associates in Farmington, he's also on the board of directors of the Hartford Medical Association, is here to tell us about the signs to check for skin cancer. And before we begin this segment, I just want to warn some of you at home that some of these pictures are pretty graphic, but they are important to see, right, Dr. Chartier?
Yes, thank you for having me today.
Absolutely.
So as we go into the weekend with the nice sun and everyone's going out to the beach and enjoying this lovely weather, I think it's important to remind people the importance of sun protection, because the most common cause of skin cancer is excessive sun exposure. So
there's something called the ABCDEs that most dermatologists use to teach people about skin cancer self-examinations. It's pretty common. Can you walk us through the ABCDEs to look for signs for skin cancer? Absolutely. So when it pertains to melanoma in moles, or nevi as we call them in dermatology, you want to look for what's known as the ABCDEs. So A stands for asymmetrical. Any mole that is asymmetrical in the sense that if you were to divide it in half, one side doesn't look like the other, would be a sign that the mole is atypical and should be evaluated, such as the picture you see in front of you. This mole is clearly asymmetrical. B stands for border irregularity. So any mole that has an irregular border and doesn't have a nice smooth border is a mole that should raise concerns, such as the picture being shown now. This border is ragged and raised. You said? Well, not necessarily raised, but if the border's irregular and doesn't flow nicely as you go around it, then that's a sign for concern. Okay. No one of these alone warrants concern, but it's together taken as a whole when you look at these that you're looking for. So a mole with just border irregularity doesn't mean it's an abnormal mole. But it does mean you probably should go see your dermatologist. Yeah, it should be looked at, definitely. C stands for color asymmetry or abnormalities, and some people call it variegation of color. And that is a mole that has several different colors in it is something that you should be concerned about. Okay. Such as the picture you're seeing, various shades of brown and black and even some pink. And this one is also asymmetrical and has an irregular border. The third is a diameter. A mole that's greater than 6 millimeters is a mole that generally signifies that it's a bit abnormal. Now, not all moles greater than 6 millimeters, and I'd say the vast majority of moles greater than 6 millimeters are benign, but when they get above 6 millimeters, it should be something that should be looked at. Isn't the common analogy that dermatologists make the top of a pencil eraser? That's right, the pencil eraser. If it gets bigger than the size of a pencil eraser, that's about 6 millimeters. Now, there are melanomas that are smaller than 6 millimeters, so that's why we don't use any one of these criteria to diagnose melanoma. Sure. And the last one is E, and E is something that has come along recently in the last 5 or 10 years, and that is evolving, and it's intuitive. If you have a mole that's changing, whether it's changing in shape, color, size, or if it's bleeding and symptomatic, then it should be looked at, because those are signs that indicate that the mole is changing and could be worrisome. Sure. So. Real quick, we don't have a lot of time left, but I wanted to ask you if there are certain hours of the day where you should stay away. And we all need vitamin C. I mean, we do need sun. So how much sun is too much sun? Can I go to the beach for an hour or two and be okay as long as I don't go all day? Well, an hour or two would be considered excessive if you're not protecting yourself. You only really need about 5 or 10 minutes of sun exposure to get your vitamin D that you need to be healthy. So an hour or two would be too much. About 5 or 10 minutes a day is sufficient. So if you're going to be out longer than 10 minutes in the sun, make sure you put on sunscreen. Absolutely. And an SPF 30 or higher is what we're recommending. Dr. Chartier, thank you so much for joining us. Thank you for having me. And hope people are safe out there on the beaches this holiday weekend. We'll be right back.